Dr. Eric Smith here with Morgan, my super duper assistant. So today we're going to talk about costochondritis. So costochondritis is a condition which your ribs hurt. So we got to actually request from this. So this video is for you to learn about and how this may be affecting you. So when you look at Morgan here, so in terms of posture, what we typically see from the side here is more of an exaggerated position. If she pulls her hair back, you can see like an over-exaggerated position, pull those shoulders back, and where it's like flat through here. And when you have a really flat back like that, what I usually find is when she leans back and puts her head back, that you're going to see kind of this indentation through here. And when you have that, what that also does is pull on the front of the ribs here. So when you see that over exaggeration, sometimes that can cause not only irritation in someone's back in this area where you have a lot of pain around the ridges between your shoulder blades and through here, it can then pull the ribs in the front. So what we're going to do today is talk about some exercises and stretches that you can do to get this not to be that position. So I'm also going to have Dr. Priebe adjust me later and show you kind of the adjustments that we typically do. So as for rehab exercise and things to do first on your own to try this, Morgan's going to demonstrate the Sphinx position that we do. And the point of the Sphinx position is really to get some more mobility. As you can see, she's really kind of pressing and getting her shoulders back the way that they should through here, and also allowing some stretching. So she's breathing through her stomach when she does that, and also not pushing too far with her like legs being off the ground or anything like that. She's really focusing on just getting some stretch through the thoracic spine and through this area here. So as for the other thing that's going to be very helpful is a device that a lot of people use, and if you don't know, you should get very familiar with what we call the foam roller. So the first position she's going to do is where she's rolling out her back. As you can see, what she's going to do is get all the way down to the bottom of the thoracic spine, and then one thing that we really like to do too is get all the way up to the top of the thoracic spine if we can, to get some movement in your thoracics. Now to help that out even more, when she crosses her arm over her chest, or her arms over her chest, you're going to see now that she's rolling through and getting more mobility. And she's doing great by tucking her chin. And if you push your head back and tuck your chin, kind of give yourself the little butt chin that we always joke about, you'll actually stretch those erector muscles in the back, versus if you just jut your head forward, you're not going to get that much movement in there. So by using a foam roller, you're going to get your ribs, which is your what we call your costals, moving, help your breathing, as well as start alleviating some of this pain. The other thing that I would suggest is by using the foam roller, you can actually loosen up your lats into on the side of your rib cage there, and you're going to find some sweet points like right underneath the armpit there, and some of them may be tender. When your lats get really tight, start pulling your body forward, you can't sit in that natural position with your shoulder. So try out some of those. If you have any questions, obviously feel free to comment below or give us a call. Hey guys, so as I mentioned, Dr. Priebe is here. He's going to work on me actually and show you what we do for costochondritis, because I have something going on with my ribs on my left side. So with costochondritis, it's an inflammation of the kind of rib cage in the area that we typically see is going to be right along the sternum through here, or right through the back here. So mine is all on the left side. So he's going to work on me so you can see what we do as chiropractors to help you feel better and let this condition move on, because it is not good and doesn't feel good. It really feels like everything's seizing up, and we honestly have a lot of people that have went to the emergency room thinking they're going to have like a heart attack or something because the pain wraps around. Your ribs should move like this, and if your back's too fixated in this position, sometimes it'll stretch the ribs in the front and push them too much in the back. So where I think I got my issue is I did some coughing over the weekend, and I think I pulled some out of place. So he's going to check me out, so I just want you guys to watch and see.
Alrighty, Doc, let's have you face down first.
Okay.
So what I'm generally going to do is I'm gonna touch the region, make sure that there's not something else associated going on with the main part of the spine. He and I have talked about this before starting the video.
Oh.
So we already know that
Right there.
right in here is where, and usually it's going to be very tender right over where the ribs meet the spine. So there's a couple of ways that we here at Optimal Chiropractic with this. One, we can adjust these manually, okay, where the patient would feel like some popping noises. We also have, for the people that don't like the popping noises, we have an instrument that I can use where I can literally go across and down the ribs and mobilize each individual rib. So we're going to demonstrate both with him. While he's face down, I'm going to come over here, and that way you guys can see. And I'm gonna work right along. I'm gonna turn this down so it's not as strong of a pulse. Okay, and I'm just gonna work right down along each of the rib heads, and you can feel them. He's got a lot of muscles, so they're a little bit more hidden, and we'll eventually get on those ones that are tender. And so this is a gentle way. If these are really inflamed, sometimes adjusting them manually is difficult and it's painful for the patient. So one, we don't want the patient to get in more pain. So we can suggest a number of different ways to mobilize these, maybe a little more gently, because some people may not be comfortable with the manual style adjusting. But we're going to demonstrate both here. So I'm just working right down along his rib cage, just mobilizing all these. And typically a patient will notice even sometimes immediate improvement in these, and they'll notice that their back moves a lot easier. They can actually breathe a lot easier. They're a lot more mobile, and they feel more loose. So Doc, I'm going to have you turn on your back, and then we're going to demonstrate adjusting these. Was on his left side. Yeah. So I'm going to stay over here. So I'm going to have it just like that. I'm going to have you relax this arm. You're going to hold it snug there. Okay. I'm just going to come right around here. I'm going to find the place where it's most comfortable, and he's going to tell me. Kind of right in there. We're going to do a little traction. Okay. And usually if they're rib heads, they're gonna pop back in pretty easy. He's, like I said, he's got a lot of muscle back here, so he's a unique case. And then we're gonna adjust the thoracics. Maybe this is gonna help too. So I'm just working up his spine. So we're not using, it looks like we're using more force than we are, but generally those are pretty comfortable, adjustments. Like I said, if there's too much pain, then we can use the activator instrument, and that makes it a lot more comfortable. We'll make recommendations for the person using some cold therapy on there, and or maybe some hot moist pack if it's been there quite a little while. But otherwise, generally these improve pretty quickly. Bad posture and things like that, coughing, like what Doc said happened to him, but using bad posture, like in front of computers, those can cause those ribs to move out of place, and then you get the ensuing spasm and soft tissue irritation around those. So.
Absolutely. Yeah. Do you mind adjusting my cervicals while you're here? Get a lot of people asking to see cervical adjustments, and Dr. Rob is very good at adjusting cervicals.
So basically what I'm going to do is I'm going to palpate, see if I can find the obvious areas that his neck feels tight and restricted. Sometimes the patient will help direct you as well. I'm going to go through some just ranges of motion just to see if I can see any tight regions. And again, he'll tell me too. I know his neck a little bit. So it's just a short thrust. We're not really, doing as much rotation as everybody thinks. It's literally here to here, but it's a quick move, which makes it a lot more comfortable for the patient. There's literally very limited risk involved. Yeah, it's kind of right in there.
Yeah. Oh, that's good.
Yeah, he's really tight in there. Okay. Sometimes, we don't get things worked out in one adjustment. Sometimes it takes repeated adjustments. Life is stressful. There's a lot of things that cause cause these things to get thrown out of whack too. But we're here to help you guys. Want to make things comfortable for you and effective, and make everybody a lot more healthy in the process. So.
Perfect. Awesome. Well, if you have any questions, contact us, and hopefully we can help you out with any concerns that you have. Thank you.